Good morning, everybody. My name is Paul Yeomans. I'm from Director of Medical Architecture, and you've just joined the Design and Mental Health webinar that is related to practical ideas and advice for designing for COVID-19. We have 4 speakers today that are also going to sort of have a different take on various different environments within the mental health sector. What I'm going to do is going to introduce you to each of them, and they're going to talk for about 10 minutes each on the various different topics. And what we're going to do is we're going to collate the questions, and we'll have a question answer session at the end of the session. What I'd ask you to do is, if you do have a question, is to pop it in the chat box on the screen here, and if you just put it with a question mark to start with, just so that we know that it's a question rather than just a sort of necessarily a comment. And what I'll do is I'll sort of I'll collate these, view them, and then sort of just at the end I'll ask the pertinent questions of each of the speakers. So if everything's okay, we'll get started. Just to again introduce the speakers, we have Victor Munez, as an architectural director at Ryder. Victor's worked exclusively in the design of mental health facilities for the past 5 years, including CAMS, adult acute, older adults, and medium secure units. And he's a project leader with involvement from inception and master planning, concept and detailed design through to completion. And Victor's going to be looking at how a current project that he's currently designing is and how it will be adapted for COVID-19, which is obviously a fairly recent adaptation. We then have Neil Orpwood as Associate Director at HLM. Neil joined HLM in March 1994 and has worked extensively on health projects. Has led on all types of specialisms from inception to completion, most notably at the Queen's Centre for Oncology and Haematology in Hull. And Neil's going to be looking at the staff wellbeing and spaces that positively contribute to wellness and mental health in these challenging times. We then have Wendy De Silva, who's the mental health lead at IBI. Wendy's an award-winning architect with over 30 years of industry experience. She has extensive understanding of the mental health sector and has worked with clients who are at the forefront of best practice. She's passionate about service improvements, and she's presented various papers on mental health design at conferences such as this in the UK and in Scandinavia. And her presentation is about the reorganisation and redesign of outpatient facilities and offices. And finally, just to finish the session, we have Rebecca Lewis-Chapman, as the founder of Interior Architectural Design Company, a qualified interior architectural consultant since 1997. She founded IAD Company from a desire to create spaces which ultimately improve lives and add value. The IAD Company works within a range of educational care-focused settings, as well as the commercial, hospitality and domestic design industry, and create environments that support individuals' unique needs. So Rebecca is going to be looking at 4 areas to help design for social distancing. Let's, if we're able to just kick it all off, I'm just going to pass over to Victor, if he's on, Victor Munez from Ryder.
Hi, Paul. Thank you so much. I'm just going to try and share my screen to see if that works. Hold on one moment. Yeah, I think we're ready to start. So yeah, thanks everyone for joining us today on this webinar about practical ideas. Obviously Paul introduced myself already, so I'm going to stop here. Obviously today I want to talk about design in mental health, COVID-19. So I have included in this slide the definition of COVID-19 from the World Health Organization. We obviously were aware of this disease already. It's all over the news. I also include in this slide a couple of images of this new 70-bed mental health inpatient facility that we are designing for the Carnegie and Islington NHS Foundation Trust at the Whittington Hospital. So at the moment we are in basically in the detailed design stage. We have submitted planning back in March, and we are expecting planning decision by the end of this month. So fingers crossed on that. So the current design was developed through an extensive stakeholder engagement process prior to the COVID-19 outbreak. So now the trust has asked to prepare a report to evaluate how the current design can be adapted to respond to COVID-19. And basically, this report is the base of my presentation today. So on this slide, I just want to highlight some key design principles that we were considering when we were asked to provide this report about how we can adapt the building to COVID-19. So the first one, it's about operational policies. So obviously, design solutions will be only effective if they are supported by strong policies to establish mechanisms and actions for service users, staff, and visitors. So obviously, this is quite key to work together with the trust in terms of design and operational policies. Second one, containing the virus. We already know how the virus is transmitted and that is highly contagious. So it's all about minimizing the risk of spread. So we can, for example, add in new doors set to separate areas in the building, establish self-contained areas for COVID-19 patients only. We can also eliminate traditional waiting areas by creating alternative waiting nooks scattered around the main entrance of the building. We can create circulation routes to allow for one-way directional movement where possible, obviously. We can also reverse the trend to share desks with more desks allocated to particular users, or we can install screens between workstations and increase the distance between desks in the layout arrangement. We should be able also to be strict on the limits of the number of people that can use a meeting room or share a lift at any one time. And of course, include distancing signage like a sticky tape on the floor, just to remind people to keep 2 meters away from each other. The next one is infection control. Obviously, this is one of the most important items for this. Obviously, we can potentially increase the number of clinical hand waste basins in the units. It's not always easy, but it's something we can look at. We can provide alcohol-based hand wrap for entering and leaving clinical areas, and encourage by design people to wash their hand frequently. So, for example, we have recently completed at the Chelsea and Westminster Hospital NICU and ICU a hand wash station that basically encouraged by the proper design of the unit to people to wash their hand before entering the unit. So there's no other way you can enter the unit without passing that hand wash station. So sometimes the design can help to get people use these habits. The next one is move to automation. So we can install automatic doors, voice-activated elevators, phone control room entry, hands-free light switches, and the use of any other technology gadgets that to avoid personal contact with surface in the building. So there's a lot of technology out there that we can use to improve this in our buildings. Very important as well, the provision of staff areas, identify area in the building that can be used for zoning and PPA storage, provide lockers for staff use, increase bike storage provision in the building to encourage staff to use alternative ways of commute, and to avoid, where possible, obviously, the use of public transport, especially during peak times. and potentially establish a schedule for staff break times to reduce the number of people using the staff rest at the same time. Another one, thermal detection systems. So this can be installed in the entrance to the building to monitor visitors, service users, and staff. We have all seen these thermal detection cameras that can pick up sick people in a crowd by finding those who have elevated temperatures. It will identify people with fever, which is one of the COVID-19 systems, as we are all aware. Then we can look at dedicated spaces, wards for COVID-19. So it's about the segregation of spaces that can be done progressively based on the level of cases identified within a patient group. In some of the next slide, we will show some examples of this. The next one is outdoor space and access to fresh air. As we all know, one of the key aspects to allow for mental health recovery pathways is to provide access to secure and safe external spaces within the wards. This could be quite challenging sometimes, especially in urban settings where multi-story buildings are the only solution to meet the brief, like in this case that we are dealing with the Camden Islington Trust. So in this project, we have provided safe and secure roof terraces to all wards, which are accessible from the day spaces of the ward and can be accessed freely by service user. Again, limiting the number of people using this space at the same time will reduce the risk of virus spread. And lastly, obviously, MEP system. It is clear that engineering systems play an important role to minimize the effects of COVID-19. So for me, the key elements to consider are air quality, water quality, thermal conditions, and ventilation filtration. Obviously, I'm not an engineer, but it seems clear that we can improve the condition of the building by increasing the number of air changes in the ventilation system, the filtration of the air that is coming into the facility, but most importantly, the filtration of recirculated air within the building. On this slide, it's just showing some of the drawings that we prepare for this report for the trust. So this is the main entrance to the building, where we are showing how we can incorporate elements that we have highlighted before, like the thermal detecting system or the hand sanitation facilities, the signage. So how this can be incorporated into the design without making many changes to what we already have in the building, and obviously incorporating different routes inside the building, and by doing that, obviously trying to minimize the risk of spread the virus. Moving to the next slide, this is an example of one of our wards. This is the 17-bed adult acute ward. In this drawing, I'm not showing the full ward, so there's some support spaces on the left-hand side of the drawing, but just showing the main day spaces and the bedroom cluster. So I just want to talk a little bit about this model. So in this building, we have incorporated what we call the cluster model. So the bedrooms are put together in cluster of 5 or 6 beds, and each cluster has their own quiet room. And this obviously is helping us with in terms of flexibility of gender, but also can help in terms of differentiate different patient groups. In case of COVID-19, we can start looking at creating clusters that are dedicated for COVID-19 patients only. And obviously that can be managed, for example, if we work together with the trust in terms of operational policies, we can convert the quiet rooms into small dining lounge areas, so the food can be served inside the cluster. And then obviously access to fresh air can be done through that roof terrace in between the clusters, you can see in the drawing. And obviously, if the number of patients with COVID increases, we can also incorporate more clusters or potentially make the whole ward as a COVID-19 ward only. Sorry, I just move. This is another example of how the same principles can be applied to a different type of ward. So this is a 15-bed older ward in this case. Obviously, the same principles apply. So again, we have three clusters of beds. Again, we can separate and segregate clusters to have COVID-19 patient only, and have access to other facilities like the quiet rooms and the central core in this case to have access to fresh air. So I think that's everything from my side. So thank you, and I'm going to stop sharing my screen now. Over to you, Paul. Let me just.
Thanks, Victor. Again, I'm sure that there's no questions at the moment, but I'm sure a few will rock up, and I've got a few of my own, which will sort of say keep till the end. So I'm just going to pass over to Neil. Head of the game. He's sharing his screen already, so it'd be great. Over to you, Neil. Thanks very much.
That's great. Thanks.
Just need to unmute.
Sorry, I was ahead of. I was ahead of the game, but not able to unmute myself. I think we're all learning lots of extra techniques on presenting webinars over the last 12 weeks. So, forgive me. Right. I'll be talking maybe just a slightly different spin on the COVID crisis, but looking at particularly something close to my heart in terms of the work that we were doing before the crisis hit, and something that's been sort of pulled up and discussed within mental health for a long time, but really needs, I suppose, a fresh focus, making sure that as a strong team of designers that we're constantly pushing for the right solutions for staff mental well-being and health, as well as obviously looking after the patients. The white paper, the 5-year plan that was due to be completed by 2020-21, identified the problems in maintaining specialist staff for mental health, and the need to increase the staffing levels by 20,000 by the end of next year. And obviously staff retention is a huge part of that. But of course, everything is thrown in the air a little bit now in terms of those strategies, and focus for the last 3 months has been elsewhere. But what I wanted to do really just to cover some, I suppose, issues that we'll all recognize and be, as designers, be well aware of and be thinking about through the design process. But I suppose just wanted to remind us that we should be focusing on some of the simpler things to really make the staff environment and the facilities that we're reconfiguring as part of the COVID crisis, and the looking at the brief and looking at how things can incorporate even more flexibility than we were trying to include before. There's guidance, there's really good guidance out there, everything from simple rules of thumb. Ben Shannon's book, Happy by Design, is a great little read if nobody's had a flick through, in terms of picking up small issues right the way through to the bigger, I suppose, compliance and actually achieving approval ratings through things like well building standard and Fitwell. And I'll try and use as part of the basis for some of the points I'm picking up through this presentation, the well building standards, key topics that you can see there in terms of the main elements of design. But I will try and fly through as much as I can, as quickly as I can, just some of the elements that I think that would be possible in terms of showing where we can help in terms of staff environment. Just very quickly, everybody's aware, of course, about the big impact of enclosed environments have on our well-being, as well as, of course, the critical part of the mental health environment for staff. And one of the key things we always need to be doing is engagement with staff, finding out what it is that they feel individually would help them improve those staff environments. So using as topics, as I said, from the basis of the well-building standard, we all know the importance of light, that ability to be able to pick us up just a bright sunny morning, that ability to be able to see within buildings, particularly healthcare, because of the deep plan arrangements we have by necessity in some instances. Those spaces that can have a reconnection with outside, so that we can maintain our body clocks in a sensible way. The design of windows, of course, it isn't just about getting that light in; it's that ability to control the quality of light. From the problems with long dark corridors, that ability just to have light at the end of the tunnel isn't always just the right answer. It's the control of those spaces around, in terms of using external walls as strongly as possible for patient areas, but always considering those staff areas as well. This, right from the very first steps of our considering a new build design, the orientation, how the sun paths will work, how that affects particularly the staff areas, how the light can be controlled for public areas, so that if traveling between consultations or patients, you actually get almost subtly a reset ability. But also those sort of staff areas where you need to be able to control the light as easily as possible, and making sure that where we do provide big open wow spaces in terms of entrances, that the glare is controlled as well. And where we do have deep plan spaces, making sure the lighting is done as carefully as possible, picking up on those circadian rhythms, taking specifications for lamps that can allow you to have a subtle awareness of the change in light over the day, making sure the lighting is safe for staff to work in, but also making it a calming environment for patients. And lighting can, of course, create staff areas, almost zones, just on its own, without the physical space having to change. One of the things that's always very difficult to control, of course, is staff's basic needs, the importance of sleep, to staff being able to maintain their work and health and well-being at work is really one of those elements that's out of control of the trusts, but actually is an element that's really important. So we need to make sure that staff are able to control and be able to reset as much as possible throughout the day. And of course, wellbeing standard picks up things like air quality and water quality that should be a basic underlying important element. Core comforts are covered, things like access to healthy food, but also choice. It isn't just about that healthy food, it's that ability to be able to choose. And the spaces where you can obtain those need to be even more now, in terms of the social distancing requirements, spaces where maybe staff will need to be able to relax in an environment which is just with staff, or where before we were trying to push and encourage social engagement. We may need to rethink those, and Victor's covered some of those, and we'll cover some of them in some of the other discussions. Temperature and ventilation, of course, are some of the core basics that really, with smells and that ability to be able to focus areas, to create working environments within the staff rest areas, and the flexibility of those spaces often really is defined by the amount of available space, and that we always find as architects is a struggle with the early briefing techniques. But more and more now, through the crisis, we've seen that flexibility and adaptability of space is going to be key moving forward. Control of sound, we know about the acoustics and how important that is in terms of people's well-being, but simple things can be done to wall finishes, to right the way through to controls where background noise can be, of course, as we know, a help to privacy, provided it's not intrusive. But anything that we provide, whether it be ventilation or sound controls, is done through a intuitive method rather than the complicated IKEA flat pack type instructions that certainly I find a struggle to understand. In terms of aesthetics, we've got the opportunity through the constant development of building information modeling management to be able to engage with the staff to understand what the key elements of a building are, so we can develop visualizations through the CAD models that are really close to the aspirations, the sort of promised delight. So the two images here, the one on the left is the original CAD image, but the main atrium space is the finished building. And so it really allows us to be able to talk and engage through those early stages and understand what the key drivers are for the design, and that picks up on all of the new briefing elements we need to look at for understanding the social distancing requirements and flows again. Interior design, I know everybody's aware of the impact of colour, how important that is in terms of creating those the spaces that staff can use just as much as patients. And probably the most important is the external spaces. In terms of the health environments we create, we obviously have an understanding of the importance of nature, the patient areas, access to fresh air and gardens and the healing environments there. But of course, that's just as much the staff's working environment as it is the patient's healing environment. So to be able to develop areas like the roof spaces to create staff relaxation areas slightly out of the way, but not too far, so that it's not a half-hour trip for them in their 15-minute tea break, if they get break at all, and create something that is out of the way but close, but also connected to nature. And of course, if it's not possible, if it's deep plan spaces, there are levels that you can do. It doesn't matter really how small the element is that you look at, they can all have an impact. And one of the things that we found by looking through Well Building Standard is the problem Well Building has is that it's an all or nothing approach. You really do, to get the full accreditation, you need to comply with their minimum credits, a bit like BREEAM, and actually it's just as important to identify which of the separate elements could be introduced that would really help staff environments. And it may be something as simple as a single pot plant, or just a view out to outside, as I say, to pick up on natural lighting levels. Activities, the active travel we know is really important. More and more people are using cycling to work, walking to work. So with healthcare, that gives you that opportunity to set up for the day, but also takes out the stress of not knowing whether you're going to arrive on time, whether the bus is going to turn up, whether you're going to be stuck in traffic. But the social interaction opportunities are also huge in terms of just bumping into people, chance encounters, and actually within the healing environment, making sure there's using just simple graphics to identify routes up through the building. So you encourage use of staircases, use corridors to display art. So you encourage use of connection and sort of resetting as you're moving from space to space. And Well Building covers things like the opportunities for staff breaks to get have fitness programs, and just opportunities to go out and sit outside, go to the local shops, use cycle facilities that have got good showering facilities, or just somewhere to externally take a bit of exercise that's a bit more fun. And in terms of the psychology, that arriving relaxed is really important. That route to work is outside maybe the scope of the trusts, but is important to understand where the staff are coming from, how they arrive. If they have to come by public transport, now there are issues about staggering times to try and do that connections within public transport. But if you do have to drive, that the car parks are of a quality that allow you to travel to that entry point for staff without it being effectively a more stressful arrival at your place of work. So we know that landscape and sunshine really helps that arrival, but of course it's not everything. You can still have huge amounts of maintenance issues that can detract from good work to get nice entrances into buildings. But that can also be an arrival point for staff. Can be the same, can either be a special treatment or can be the same entry point as patients. And lastly but not least, one of the key areas we find when we're looking at particularly now with the rebriefing and the reconfiguration of hospital environments, is the problem, age-old problem of storage and inability to provide sufficient storage. The cluttering of corridors is stressful for patients and even more so for staff. So the ability to be able to open those up by creating storerooms, maybe that helps the corridors, but we need to make sure store areas are easily accessible in terms of the equipment, just in time ordering, asset tagging, opening up corridor spaces to really create a nicer and working environment for staff. And therefore really that working environment and the staff reset environment helps to create a better staff environment, but also a better patient-centered care. So that's me, Paul. Sorry, I've sped through that, but there was a lot to get through for 10 minutes. So I'll stop sharing and hand over.
Great. Thank you, Neil. Taking care of staff, obviously very important, as well as thinking about the patients. So we'll come back to that. Wendy, if I can just hand over to yourself, looking at the reorganisation of outpatients and office facilities. Thank you very much.
Thanks very much, Paul. So what I'm going to look at today really is outpatient areas and offices, and maybe also touch on a few workforce issues. So the brief was COVID-19, what are the practical considerations? I'm the mental health lead for the IBI group, and we are a global group. And one of the things that we do in addition to architecture is intelligence. So we're looking at things like smart cities and smart systems and technology. So what's happening with COVID is really fast tracking us into some of those areas, which I think is really interesting. So it's a huge opportunity here to expand our horizons. We don't have any choice, which is quite interesting. And I've been quite surprised how people have been liberated by this new landscape. So some of the things we are discovering is that many of us can work from home. We are discovering what works well about what we're doing from home. We're also being quite frustrated by what does not. So I think the challenge for us is what do we need to do differently? And I think we need to be inventive. I mean, many of us love a challenge. We are being innovative. Every single one of us is being innovative about what we do out of necessity. We are being ingenious. There's all sorts of workarounds being discovered for the sort of work we're doing. And we're also using technology. And we're using it. I mean, I'm a technophobe, and I'm discovering that actually it's quite useful and very useful for me to be able to socialize, which has brought a huge new way of being for me. Thank goodness in lockdown. So the implications of COVID-19, we're still very much in the process of working our way through them. We know we'll have to keep our distance for a period. We really don't know what shape the future waves are going to be. We don't know, and we don't know the timescales either. So we're going to have to be flexible about it. But these graphs, I think, are just two scenarios. There will be more. What we do know is that we're going to have some strategies to deal with it. And Interestingly, on the technology front, NHS Digital had already started at the beginning of this year piloting Attend Anywhere, which is a video digital marketplace for video consultations. And what they've done is they've brought that pilot study forward and broadened it to do with COVID. And the gov.uk website has loads of information. Just go there. And I'm going to apologise in advance. I can hear that the rubbish van is coming, and I knew it would happen just now. So bear with me if there's lots of noise. That's one of the frustrations of working from home. So Attend Anywhere on the NHS. Tees Weir Valleys are already using this. They were one of the pilot studies and they broadened it. There's no need to register online. You are sent a video appointment via email or text. You only need to have a smartphone to be able to do this. And actually, all you have to do is put your date of birth and mobile phone number in when you do get the appointment. There's a link here to some fantastic YouTube videos which explain the system, but either go to Tyne, Eskom, Weir or the NHS websites, and you'll be able to discover a lot more about it. One of the other trusts that's using that system is Moorfields, and the feedback both are getting actually is that the consultations are working very well. Moorfields know it's particularly useful for older people who've got comorbidities. At Tees Eskom Weir, a survey of about 500 people said 94% of them would be happy to use Attend Anywhere again. Now, obviously, there will be some people for whom it's not suitable. So I think we need to understand who those people are and what the issues are there. But for Moorfields, staff safety is a huge issue. The patients are triaged. Do they really need to come in? And if they do need to come in, their temperature's checked and they're seen behind specially designed screens. Now, that wouldn't be perfect for mental health, but I think we've got to think about what the issues are for our staff, as Neil said. So I thought practically I'd look at what we were doing on outpatients and offices, one of the projects that's we're working on, which is the Pairs Children and Young People building, which is with South London and Maudsley and King's College London. So the sort of things that we'll be looking at is how do we reduce the staff and patient load in the building? How do we have fewer people in there at any one time? We'll be looking at virtual consulting and virtual working. We'll be looking at staggering appointments. I mean, a lot of these people work in groups and they work Tuesday, Wednesday, Thursday. Can we spread the appointments so that there's a bigger spread of how people might be working? We'll be looking at how we might be able to form bubbles of co-workers, and I'll talk a bit more about that in the context of what we're doing in that IBI office later. Social distancing in waiting areas. I think Rebecca will be talking to us about social distancing and what we might do. Do we use screens? Do we repurpose other rooms? Do we look at external waiting areas? We know at the moment we're encouraged only to meet externally. So we also have places like roof gardens available. Do we actually look at repurposing the way the building's done for the duration, and we don't know what that duration is, of the COVID pandemic. So outpatients, reception areas, we've got to minimise the patient load. We've got to make it spacious, and I think Rebecca will talk about delineation options. On the therapy areas, we've got spatial distancing. I'm calling it spatial rather than social. And then do we look at service user or staff bubbles? And yes, of course, we're going to be looking at more virtual meetings and virtual presentations. On the office front, there's lots of opportunities to be explored. Here we've got South London and Maudsley and King's College research has been deliberately brought together for translational medicine. And we've got in the middle of this shared collaboration zones. It's all part of the ethos of bringing people together. There's a few cellular rooms. So I think we've got a lot of thinking to do here, and we don't we haven't yet worked our way through to the answers on this. But what we have done in the IBI London office, and this is just a very practical example, is we've looked at what we will do when we come back to working together. So we'll have social bubbles, we'll have 40 staff in the office, and we'll be splitting ourselves into 3 teams, red, blue, green, and the maximum number of people in any one team will be 15. And then each team comes in for 1 week, and then it rotates. So what that means is there's 14 days, which is the quarantine period between each bubble of staff coming in, so that we can then self-isolate that bubble if somebody gets ill. And you can see on the right-hand side how we've marked those desks out. We will need to fine-tune it. The guidance is to work from home where possible. And then the other thing that we've done is make sure that everybody stays, each individual stays in their allocated desk position, so that there won't be any sharing at any time. I mean, we will be deep cleaning between, but this is an additional measure that we will be taking. I thought this was interesting, actually, the network model that Moorfields Eye Hospital are looking at. Sumita Singha, who's a NED on the workforce, she's also an architect and a friend of mine. She told me that what they're doing at the moment is their current 27 sites, they've consolidated into 7 for essential services. And while they're working like this, they're identifying where all their staff live and where they work. They're looking to minimise the need to use public transport and investigating walking or cycling to work opportunities. So what this does, as Neil said, active travel is really good for your health and well-being. And of course, minimising transport and carbon emissions is really good for the planet. So when we actually come back to work from the whole 27 sites, any opportunities that there are to work differently with people going perhaps to different buildings will be something that they'll be looking at, which I thought was really fascinating. So lastly, well, the fallout and side effects. Well, I think the fallout will be life-changing for our generation. We've no idea what the timescale is. We've no idea what the social and economic effects will be. We know the COVID crisis coincides with the climate crisis. And I think we've got a part to play in making the most of the positive side effects of this dreadful pandemic. I think it's our responsibility to future generations to think hard about what we do and how we do it. So that's my bit. Thank you very much. And I'll stop sharing. I saved you from the worst of the reversing refuse truck as well. There we go.
Thanks, Wendy.
Thank you.
I think as designers, we always look to to see where the opportunities arise for better design and how environments can be adapted. So I think you're obviously taking a lot of that on board. So finally, we just got Rebecca Lewis Chapman from IAD, and Rebecca's going to be looking at 4 areas to help with social distancing design. So if you're ready, Rebecca, to share your screen. That's great.
Yeah,
lovely.
I am. Can you see it? Yeah. Can you see the screen yet?
The slideshow mode.
Oh, sorry. Okay.
Yeah, I can see it. It's just do you want to put it in the slideshow?
Yeah, of course. Okay.
Great.
Okay. Can everyone see it okay? Right, okay.
Yep.
So during these times of heightened anxiety, it's our role to be even more mindful of the way our environment impacts our mental health. We all know that a well thought out scheme can positively impact the way we feel about a space. and the opposite is very true. Once the high alert status has started to dissipate and we've had a chance to breathe, we can start considering the medium to long-term potential solutions. All of the care homes we've worked with, the overriding emphasis of the brief has been to ensure that the space does not feel institutional. This has been such an important point for the client, and we all instinctively know that if we are surrounded by elements that create anxiety on a continual long-term basis, the stress can impact on our health and well-being. If we're designing for vulnerable people with care and nursing home environment, ideally we would deinstitutionalize as much as possible the space to create a more intimate, homely and comfortable place with a sense of relaxation. I say this because from what I've seen and experienced, the vulnerable people coming out of isolation, one, have a heightened sensitivity towards the rules for social distancing due to their fear around COVID-19, which therefore requires a physical separation solution. And two, the stress as a result of the feeling of exposure prevents people from wanting to leave the safety of isolation, which could lead to future issues around the loneliness and depression. We've been researching potential solutions and ways of supporting new behaviours and requirements developed as a result of COVID-19, and this is what I'll share today. The more we have open collaboration to share the process of creative problem solving, the quicker and better the solution will benefit the people who need it. So here we go. So we were looking at, the 4 points are where we get our inspiration from, practical layout ideas, technology, and distance reminders. So inspiration. During the process, we've been looking to other design sectors and history for inspiration on alternative solution. When the brief states not institutional, the natural direction for research would be domestic design. However, in this instance, we've also been looking into ways the hospitality and office design sectors provide solutions. Specifically the office design industry, as they have a body of work that looks how introverts work best and focus learning ideas, which naturally align themselves to isolation. We have also looked at social hierarchy and privacy solutions in historic bars and pubs, as well as looking we've also been looking at private dining end of hospitality industry, again, to sort of create that isolated design. Whilst we would need to adapt and develop from these initial sources, they lend themselves in basic concept to work for the issues that we need to solve here. In terms of practical layout consideration, across the board in all buildings, waiting areas have been identified as hotspots for potential cross-contamination. If we're designing from a new or refurbishing, we can aim for the ideal scenario of designing smaller spaces to separate people. But in most cases here, we will be asked to retrofit a solution. In this instance, we can look at the office design industry for inspiration. As I said, they've been working on ways to facilitate different types of working methods for a while now, and their introvert orientated solutions fit very well here. Whilst we would be looking to adapt to cater for the specific needs of our clients, using the style of furniture shown here covers the requirements in terms of enabling the user to feel protected and safe. Screening have obviously been used throughout the COVID-19 pandemic. There are quick and easy win for separation and to enable physical closeness within a small space whilst feeling protected. We can use the film to decorate in a way that is most appropriate for the area, whether obviously that be a sense of serenity or fun. With regards to technology, as already been mentioned, we would usually work with technicians who specialise within the industry. However, it's worth listing the items that have come up in our research to avoid touching high-risk surfaces and cross-contamination. The main areas we've come across is the automatic doors, voice-activated lifts, hands-free light switches, sensor taps, and sensor sanitize dispensers. We've also been looking into fabric technology. The suppliers of antimicrobial fabrics are able to prevent cross-contamination from upholstery and soft furnishings. Specifically, Panaz have a fabric called Shield Plus that have been proven to be effective against coronavirus, which makes it a viable solution for the areas with the greatest risk to cross-contamination. They also offer a cleaning solution which is water-based technology and forms an invisible protective layer, delivering a unique antimicrobial barrier that kills bacteria immediately on contact and offers long-term protection. So distance training, we were looking at the ways in which we can give a sense of space and distance without using stickers on the floor. Some of the solutions we came up with were for temporary quick wins that can be easily removed. Others were for a more medium-term solution that may well be needing to be integrated in some form of distancing into our lives until a vaccine is available. We look at the application of 4 items below that could indicate space. So we're looking at textures and materials, colours, lighting, planting and water features. The textures and materials, we can use a combination of these on any surface to differentiate space. These can also inform on a sensory level with sound, touch and sight. We can look at, for example, exterior floor covering. If we create a brick and gravel system for exterior space, and a user gets into a conversation with someone and forgets for a split second the distancing rules, the texture and sound of the gravel changing to brick would act as an alert. And so this could also be applied to different fabrics on fitted seating and sort of a number of other applications. In terms of colour, this could also be used on the floor and walls to create awareness of the space with the additional benefit of it being very cost effective, and it can work with an existing scheme. Lighting could easily be incorporated into an indoor space and outdoor space with the use of solar panelled lighting as shown to create zones. The last one, planting and water, this is a solution for interior and exterior layouts. It's an alternative to acrylic screen and is a good way of bringing biophilic design qualities into the overall design. Defining the space with screens and by using a repetitive format to calculate distance in the example here with the fountains. Also, if you use solar water features, this can actually be moved as the guidelines change throughout the time. Finally, during this time, we've been watching incredible creativity and innovation to find solutions and get through this safely. Some simple and some make us smile. I want to say thank you for your time and thanks to Design Mental Health for the invitation to be part of this discussion.
That's great, Rebecca. Thank you very much. So that's the end of our presentations. No doubt there'll be a few questions, which looking at the chats, there are a few already. So I'll just sort of summarize some of these, and then we can get stuck into them. So we've got James Lee and Jenny Gill sort of talking about space usage. James asks, space plays a key part in dealing with the current social distancing challenge. With this in mind, and potentially with other pandemics predicted, will the design and size of facilities change, as well as spaces becoming more flexible and adaptable? Jenny asks, thank you all. Clearly there's going to be a requirement for more space for social distancing going forward. Any ideas how this increase in space will inevitably mean increase in cost, and any ideas how this can be mitigated? And then James sort of wraps the sort of space issue up, I think, by saying, does this mean going upwards rather than sideways? We've already looked at sort of Victor's scheme, which is obviously in a dense part of London, and where spaces are really at a premium. So sort of interesting sort of questions there. I'll maybe sort of kick off a little bit myself, and then maybe open it up to the others. But I think from what we're sort of seeing, actually sort of flexibility is absolutely key. That sort of staff and patients can use the space that has been designed as flexibly as possible. I was chatting to a clinician a couple of weeks ago where they were sort of talking about, well, we've had to adapt a space for doffing and donning of kit, and making sure that we can easily sort of have access to a sink just for sort of washing our hands whilst we're doing the doffing and donning. And that's not necessarily something that we've kind of come across in sort of mental health before, but it's clearly sort of a big issue now. And I think also the use of outdoor spaces as well is really key, and whether those outdoor spaces are sheltered, so it allows people to sort of sit outside, socially distance, and obviously the climate in the UK is not great. But actually being able to sit outside when it's raining is a good design feature, I think, and it's something that we've done before. Just open it up to the others if they've got anything else to talk about in terms of space and sort of the adaptability side of things. Anybody want to come in on that?
So I have something to say. I think one of the things that's fascinating is we've adapted so quickly to not using the spaces and multi-using our home spaces. We're not going to have huge amounts of money left over to build 3 times the size of our buildings. So I think it's going to be a bit mix and match. I think we're going to find that we can do a lot of things much more cost effectively and planet effectively and more healthily by not traveling around unnecessarily. I also think we're absolutely going to need the space and the measures as well. And I don't think we're going to be able to call how long this will go on for. So we need to work through all of this in parallel.
Yeah, I think there's also Neil.
Sorry. Yeah, sorry. It was just on the back of what Wendy was saying, really. I think that's a really important point, that we're finding that the big changes that have happened over the last 12 weeks are not wanting to be lost. The way that clinics have moved to virtual clinics, and effectively lots of facilities have freed up space in their outpatient departments by moving into the community. And of course, those kind of discussions were going on before, that need to take healthcare to the patients rather than bringing everybody to those big hospital sites. So I think there's also that opportunity to discuss time, the fact that a lot of our specialist facilities are only used for half of the day, and there is also that flexibility to make us further apart by taking us further apart in time as well. Everybody's got used to being able to cope with a different timetable almost, as well as the ability to go out into the community. So I think there's there is definitely a need for agile space, flexible and adaptable. We've shown that even some of the probably the worst spaces that we thought were as part of the estate can actually be converted, given the forced changes we've had to do. So yeah, I think there are lots of different solutions potentially, but it's the
Just having a few connection problems there, Neil. Yeah, I mean, I think necessity is the mother of invention, isn't it? Yeah, I was just saying that I think necessity is the mother of invention, isn't it? It's the fact that sort of the healthcare system and the care system, the NHS and the care system, are actually now being sort of really forced together, has actually made the whole sharing of information and the looking after of people, I think brought that a lot closer together than it's ever been. So there are clearly benefits in all of these things, along with sort of what Wendy was saying in the outpatients side of things as well. Robert Walton asks, there's a lot of talk about antimicrobial fabrics. Will they be used as an excuse to skip on hygiene and cleaning? As I understand it, all the tests are being carried out on feline COVID, so they will work on human COVID to the same degree. I have to say, I don't profess to be an expert on antimicrobial fabrics, so I'm not sure if I can answer that one. I don't know if anybody else can.
I can answer it.
Great.
So there's a maintenance that goes along with the fabrics. That's quite a strict cleaning method, and so you can't skip on the cleaning just because of the nature of the fabric.
Well, there you go. Thank you very much, Rebecca. I'd stop one question for Victor. Obviously, dealing with sort of a multi-story mental health scheme brings about its challenges and the amount of space that you have, Victor, in the scheme that you showed. And one thing that sort of yourselves and we also do is also zone the building, so that the patients, if you did have an infection, that those patients could actually be sort of looked after in their own little zone, which again is back to that adaptability side of things as well. One thing that I'm not sure if it was your scheme or it was somebody else's, but I had heard of clinicians sort of talking about putting bedhead medical gases in some patient bedrooms. Has everybody come across that?
Yes. Yes. So that has been a request from the trust in this for this building that we're working on at the moment. So they have asked if we can look at how we can incorporate medical gases into the mental health wards, which obviously is challenging because of the provision of space we need for the manifold plant room and the bottle cylinder storage and all of that. But in addition to that, obviously, is the ligature risk of the medical gases outlets in each bedroom. So obviously, we're looking at that to be potentially incorporated in all the other wards, which are a much more risk group in terms of COVID, and obviously how we can treat mental health patients for COVID without moving them out of the mental health facility setting, because obviously that will probably create other challenges if you try to treat someone with mental health issues in a standard acute hospital. So it's kind of a, you know, try to minimize the risk, but at the same time incorporate something for future proof, really, in terms of what's the next pandemic that is going to affect us. So yeah, we have been asked for that, and we are basically reviewing that at the moment.
Fascinating. Be interesting to sort of see where that one goes, because it really might sort of set a potential precedent there. So I suppose it's a case of watch this space. Joe Crawford asks, how good are antimicrobial products against viruses? Viruses are essentially dead, so what effect can they have? Again, Rebecca, I'm not sure if you want to answer that one, but yeah, I don't know if it's sort of similar to the question before it or not.
I think it's not my area of expertise, so I could just direct people to the PNAS website.
Yeah, I thought it was a bit of a hospital pass there. Stephen Wilson, I work in mental health hospital. We had service users that had COVID-19. We had to try and confine and adapt the change, the use of rooms from offices to bedrooms. High risk of ligature and short supply of materials as businesses shut down during lockdown gave us huge logistical nightmare. For hand washing, we had added temporary hand wash units outside each ward. Yeah, I mean, it's obviously not a question, but it's a statement. You know, clearly, you know, right at the start of this pandemic, I think everyone was sort of rushing around just trying to work out, you know, how people could actually deal and care for patients and their staff. You know, at the start of this, which, you know, I can't imagine you were alone, Stephen, in thinking sort of trying to cope with the various different things, and actually obviously trying to you know, change certain rooms into bedrooms. Clearly difficult, but I suppose it does go back to that whole thing of adaptability and flexibility, doesn't it? And trying to, you know, you're never quite sure sort of how, you know, you leave a building when you finish designing it and it's been built, knowing full well that actually a lot of these spaces might change quite dramatically over the years of its life, and there's obviously nothing as constant as change as the NHS. So I think as designers, I think that's all we can do, is to design as flexibly as possible. I know it came up in a couple of conversations in the webinars yesterday about sort of you know, how far do you take adaptation and flexibility in design. So it's an interesting one. Jenny suggests I would suggest that all areas of building should be anti-ligature, not just the patient areas. So yeah, it's a good point, and making sure that some of those spaces can be easily turned around and changed in future. Okay, so anybody else got any other questions, queries? Anybody in the panel want to ask anything?
Well, yeah, just I just want to come back with one of the initial questions about space and cost. So obviously, from my point of view, cost is always an issue. And then we heard that yesterday in one of the webinar where the panel were talking about resilience, and that obviously money for mental health facilities is not coming through as it should. So obviously, cost is a big challenge in terms of a space. Yeah, ideally we should be able to increase the space of the rooms, but again, that's go against cost, and we all know that we have to face value engineering in every project we do, and we need to cut cost always. So I think it's more about what we all have discussed about flexibility, about making the correct use of a space, we all know about those rooms that are in every hospital that are only used a few hours a week, and they are not used in the best way that they can probably be used. So again, about how we design facilities for flexibility and how we can optimize the use of every single square meter in our buildings.
Absolutely, absolutely. Okay, I think I'm going to wrap this up now. But thank you to the speakers. I think it's we're clearly going to watch this space. Really, I think it's such a, you know, things change by the day, don't they? And you know, various different directives as people try to understand how best to deal with the current situation. So it's fluid, isn't it? That's for sure. So I'd just like to thank Victor Muniz from RIDA, Neil Ortwood from HLM, Wendy De Silva from IBI, and Rebecca Lewis Chapman from IAD company. So thank you very much for your time today. If you do have any other queries, questions arising from it, I'm sure sort of the organisers of the event will be able to put you in touch with various different people. So thank you very much for your time, everybody. Goodbye.